All right, good morning, everyone. I'll officially call our December 16th, 2021 public safety meeting to order. Chief Davis, would you please be so kind as to lead us in the pledge, sir?
Sure.
Thank you.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Chief. Appreciate you doing that. All right, Tom, Maria, do we have any public audience? I did not get any advanced comments.
I did not receive that.
Okay. All right, we'll move right on to the heart of the agenda. Some quick housekeeping items. We do have the minutes from September 17th. Mr. Pearson, thank you for running that meeting. Are there any questions, comments, updates, objections, amendments, et cetera, to those minutes? All right, they'll stand as presented. Our team in Town Hall was able to put together the proposed 2022 meeting schedule. Comments, questions on that meeting schedule? That would be March 17th, my favorite day to meet. So you're all in luck. You got me in for another 2 years as chair. So I promised a special meeting on the 17th. June 16th, February 15th, December 15th, and of course, ad hoc if needed, as we have done over the last 2 years, especially in light of COVID situation. All right. I'll entertain a motion for the record to adopt those meeting dates. Chris, I need you for this.
Sorry.
All right, Chris made that motion. I'll second it. All those in favor? Aye. There we go. All right, so that passes. So those are officially our meeting dates for 2022. Thank you for that. All right, we'll jump right into the updates. Farmington Valley Health District. I don't believe we have Jennifer with us. Maria, do you just want to run through some quick stats, which are sadly not some good ones?
Sure, no, thank you. We're definitely seeing a very significant uptick.
Maria, we can't hear you.
Let me see if I can fix that. One second.
Technology budget's a little light in the selectmen's budget, so we're working on that.
Is this a little better?
Yes, ma'am. Thank you.
Okay, great. Sorry about that. Hadn't had my coffee yet this morning. Didn't get my audio set up properly. I apologize. But good morning. We are seeing a very significant uptick in positive cases again. In fact, our positivity rate amongst those folks being tested for the week ending, I believe it was December 4th, was 7.2% here in town. That's actually the highest percentage for our positivity rate since the state had begun tracking data back in 2020. We're also seeing, as I mentioned, a very significant number in the overall number of cases. So we did reach red alert status, which we hadn't been since last winter. And for the most recent data that was released, we were at 33.2 cases per 100,000 people, which was an increase from 22.5 the week prior. So not only as a town are we not trending well, as a region we're not trending well, county, statewide level. The health district had shared some information on a more regional basis. So for the health district, week over week with the most recent data that had been released, they went from 153.8 cases as a health district, so that's our 10 towns, over a 2-week period to 266.8 cases per 100,000. That was just a change in the matter of a week. So the health district as a region, as well as Harford County, on the CDC sort of alert status, if that's what we want to phrase it as, is currently at high risk, which is the highest level of risk. And again, red alert, where we are for the municipal alert system, is also the highest level of risk. So the health district is encouraging people, regardless of vaccination status, to please mask while you're indoors. That is also the CDC's recommendation in cases such as this. We are still requiring masking in our municipal facilities at this point in time. If somebody has a private office or something of that nature, like I'm sitting in a private office right now by myself, we'll unmask, but generally in most circumstances are masking in municipal buildings. As you all know, we do provide essential services such as, plowing roads in the winter and needing to make sure that our sewer treatment facility is fully operational. So again, given the nature of the essential services we provide and the level of cases that we're seeing, we are still requiring masks in our municipal building. Like many employers, we're also seeing an uptick in our cases within the workforce, many of whom are vaccinated, so many breakthrough cases. And also just because the caseload is so high throughout the region, we're having a lot of people who are being contact traced and they have been in close contact with a positive case. So between quarantining and positive cases, we are starting to see, some temporary, staffing impacts. And again, that was something we really haven't seen since last winter into early spring prior to people being able to become eligible for vaccination. So again, I think the trends that we're seeing here at the municipal level are probably very similar to what many people are seeing at their private places of employment. We are continuing to monitor the situation closely. The last time we had a case uptick, which was over the summer, the Capital Region Council of Governments, which we are a part of, it's a little over 30 towns in our region, pulled all the municipal CEOs together, you may recall, to discuss a potential mask order, which many of the towns in the region did implement at that time. They have not moved in that direction at this point in time. So if that does change, I will certainly let folks know, but at this point in time, that has not taken place. In terms of just vaccination, some positive news to share. As many of you know, vaccinations are now available for children ages 5 to 11. Our health district did a great job. They sponsored first dose and second dose clinics, one here in Simsbury, one in Granby, one in Avon. And as of December 8th, just under 50% of our children in that age range of 5 to 11 had received their first dose. So subsequently, as the weeks are passing, that number of fully vaccinated children in that age group is that number is starting to go up. With the most recent second dose clinic at the Simsbury Middle School, we had 400 children get their second dose. So the health district just did an amazing job. They had a large number of volunteers. We could not have done that without the volunteers. I think it took over 50 volunteers at each session, but they just, again, I just can't thank them enough. They really put a lot of effort into it. The clinics went very smoothly, and it had a great impact for our community. So I just wanted to be sure to recognize them for that work. Just lastly, too, one other message from the health district. They are encouraging anyone who is experiencing cold-like symptoms to please stay home and to please seek testing. What they are finding is a lot of folks, particularly vaccinated folks, I believe, who may have very mild cold-like symptoms, are going to work thinking it's just a cold, but then they later find out that it is in fact COVID. So they are really just encouraging folks, if you are experiencing those symptoms, to please seek testing.
All right. Thank you, Maria.
Um,
Any questions for Maria? And to add to that, Maria, anything else from the town manager's office?
Oh, Sean, thank you. Just under, Karen, I think has been doing a really nice job for the last several months doing data analysis. And I know she's going to touch on that in her report, but that's something that Sean and Eric and myself have been working on with her. So I look forward to a good conversation regarding that later in the meeting.
Absolutely.
Yeah.
Appreciate that. All right, Michael Berry, Emergency Management.
Good morning to everybody.
Morning.
If anybody's been outside recently, you've noticed the wonderful weather we've been having, and we're going to be probably setting a record high temperature today. So we are hoping that the wonderful weather continues. We are in the middle of December and we're almost hitting 60, 65 degrees. So crossing my fingers that we continue to have this wonderful weather and we keep all the storms away so we don't have any issues. With that weather, we had just a couple blips. We've been working with the fire department, the police department, and the highway department. We had a couple windstorms come through, but really nothing of any consequence so far. So again, we're crossing our fingers for a good season so far. To dovetail what Maria said about the COVID clinic, I attended the clinic on Saturday for the over 400 children getting vaccinated. And I wanted to thank also the Farmington Valley Health District for a great job that they did, but also I wanted to recognize the Medical Reserve Corps, which is a group that was activated by Region 3, and they are a group of doctors and nurses from around the region that volunteer in an organized manner through the region and come out to these events and help out when there is a need. And there were dentists, there were doctors, there was all kinds of specialties there, and it was great to see. We have over 15 different stations to vaccinate people, and there was not one appointment that wasn't left open, and there was not one person that did not come for their appointment. So every single slot was filled and every single person showed up. So that they did a fantastic job, and I just wanted to thank them for that. Also, I'd like to thank everybody for the Simsbury Celebrates. I think it was a fantastic event. It was a great turnout for the town, and I think everybody had a great time, and just wanted to thank everybody that had a hand in putting that together. I think it went very well, and I think the large gathering policy went together very well on that. WSIM, the radio station, is switched over to our holiday programming, and we are putting out our holiday music for everybody if you want to switch over to it, 103.5 FM. And also we're switched over to our holiday safety messages that we put out through there. So we're pumping out messages through that for that. As for social media, we've had positive response with the social media on the different things we were working on, from the cell phone service issue that we're working on, to the different events that have been going on in town. They have actually placed me as one of the subject matter experts on one of the sites, which is, I don't know why they did that, but they did that. So whenever we need to push information out, it does not have to be approved by a moderator. We can put it out there and it gets immediately out to the public, so that if there's anything that needs to get out to the public quickly, we can make sure that that gets out.
Mike, just to comment on that, I think that is really important, because we all do follow those feeds on Facebook, and people do find your updates very reassuring, and do look for you as the expert on that. So I think that is an important note, because people take that site in particular very seriously. So I think that's a positive improvement in how the town communicates. So nice job there.
Yep, thank you. But I'd also like to thank everybody else, because any message that goes out there is not something that's just put out by me. It's confirmed by the group, and it's something that make sure that everybody has a hand in, and make sure that there's information that's truthful and forward, and not releasing any information that anybody doesn't want out there. So I want to thank everybody for helping out with that. Just a note, a lot of municipalities in the area, including my workplace, has been hit by cyber attacks. So if you have computers or anything, make sure that your web security is up to date, that your computers are up to date with all their Windows update, or or any updates that you have been pushed by your companies, because the attacks have been getting much more sophisticated, and the damage that's being caused is quite extensive, and it spreads very, very quickly once it gets in. So I've been getting notices from the government and the local agencies. So make sure that everything is up to date with your cybersecurity, and make sure that that's up to date, and we are good on that. And that is good for emergency management for this month.
That was a very excellent brief update on a lot of large topics. I'll put another point on that cyber update. If you're not sure, don't click it. In this fast-paced email world, we are the culprit of these cyber attacks, unfortunately, and that when we click the link is when the infiltration happens. So we are at the front line of defense, and I know the town and supporting agencies are educating our employees on that. But it's really important that if we're not sure, to get Rick involved, or your IT expert. Do not click the link, do not click the meme, do not click whatever comes through, even if it looks like it's official, because that's part of this. It will come from the chief, one of the chiefs. It will come from somebody official, but it will be fake. So we need to all be really diligent on the cybersecurity front, because, Mike, as you said, it's very, very damaging when it happens, and it's also very expensive. And again, on a happier note, I was able to attend Simsbury Celebrates, and I would encourage my peers who wanted to jump in as well. But what an outstanding event, both from an organizational standpoint, from the town, Tom Taberski, and the volunteers running it. Obviously, the fire department being the centerpiece of the parade, and making a lot of people happy and bringing back a lot of smiles, but also police, public works, ambulance, the supporting groups that kept everybody safe, both good and bad. I think this was the first time that folks have noticed how the public safety plan is run, the presence of plow trucks and otherwise. And I can tell you that it was reassuring for a lot of folks to see that presence, not only because they love seeing Tom's guys, but also those trucks at either end of a roadway. When you've got your kids out there, it does make people, including myself, feel safe. So appreciate the level of planning and execution that went in there. And then obviously the officers throughout the parade route, Chief Davis, great job interacting with the kids, managing traffic. There's a lot of people down there. It's dark. It's not the easiest scene to manage. And I thought everybody did an outstanding job. So. All right, Chief Davis, the floor is yours, sir.
Okay, good morning. I guess I'll start with just briefly talking about obviously we've had a busy week, about the tragic incident on Sunday night. All I can really say is our hearts and prayers go out to the family and to everybody impacted by the tragic situation on Sunday night. Obviously, it was a very difficult situation, but I'm really proud of the way our officers responded to the scene and to the situation. It was really exemplary response, and it's just a tragic situation. And but we also want to thank all the town leaders, the community for the outpouring of support for the family and to the officers. It really does help make a difference. So thank you for all that. As far as personnel goes, we have 2 officers still out on long-term leave. We have 1 sergeant who just returned from long-term leave. We have another dispatcher who just returned from long-term leave. And we have 2 officers who are going to be graduating from the academy next Thursday. They'll be getting their field training program. So that will be about 14 weeks or so. So we'll probably see them, in a solo B capacity, probably somewhere around beginning of March, which will be helpful. We have been impacted by COVID as well. We have 3 officers out, as well as 2 dispatchers. And our radio system continues to be worked on and hopefully fully implemented by, they said at the end of December, but I'm thinking it's going to be more probably mid-January or so. So, I'd also be remiss. We have our animal control officer is going to be Mark Rudowitz will be retiring effective January 31st. I can't say enough about the job that he's done, and you all know probably better than I do. I mean, how beloved he is in the community and the department. What a great asset and resource he has been. For the last couple of days, I've been going to lunch with him at when we go to Fitzgerald's, and I swear everybody that's in the different stores comes up and knows him, and remember my dog? This is my dog, and everybody loves him, and he's going to be a huge loss. We're going to wish him well in his retirement, and we're starting to try and put together the steps to try and start replacing that position. But obviously, we're not going to be able to replace Mark as he is. But so that's that.
No, Chief, that's well said on Mark Rudowitz. Yeah, he is a pillar of the community when it comes to helping us all with our animals and outstanding presence. Obviously, on the more sad matter, I would agree from I think the Board of Selectmen side, and my peers are welcome to weigh in. Sadness doesn't even begin to express what I think everybody in this community is obviously feeling. Shock that it's happened here. But what I can say in the small bright spot is, as an uneducated observer, as somebody who's been paying attention, for the last decade, the professionalism, Chief, that you and Chief Bolter and the entire police force exhibited, both on the radio, through the media, with your updates to all of us, with the way you collectively handled the event, with the officers that went into an uncontrolled scene, not knowing what they were going to face on the initial call, is nothing short of outstanding and phenomenal. And I couldn't be more proud as a member of this committee of what you folks do, despite the tragic nature of it. When this community is at its worst, you officers are at its best, and it's a sad reminder. But I'm so proud of what you folks were able to accomplish this weekend in partnership with so many other communities. And I know you thanked them. And we do obviously thank all of our partners, right? Because in our suburban police forces, we're only staffed to so much. We only each have so many skills. And the fact that we are able to, in a moment of tragedy, lean on each other and help each other out with no questions asked on those mutual aid responses, I think is phenomenal. We don't often have to go there on the police side, right? But when we do, it's pretty tragic when we have to. But again, I was so moved by listening to the coordination and what you all did. So thank you, and please share with the officers my and our thanks for what they did, because nothing short of heroic from my vantage point. I don't know, Chris, Wendy, anyone else want to weigh in there?
Sean, no, I think you said it well enough. Nothing more needs to be said by anyone else, as far as I'm concerned. Thank you for those words. Thanks, Chief.
I just want to add the community really is rallying together, and everyone, of course, the family respecting their privacy, but everybody in the community is feeling the loss. And that if you know of any events that are going on, feel free to share them with any of us. We can push them out. And also that we have our social services and mental health department available for people.
Thank you.
Thank you for that, Wendy. And Maria and First Selectman Maxidis, appreciate your leadership on coordinating with the police department to make sure that you're pushing that information out there. So well done by all folks. Commissioner Long, anything to add from your vantage point, sir, on this point?
Yes, I do, John. Thank you. I echo what you said and what the others have said. I think the performance of the department on Sunday was exemplary and couldn't have been better. And of course, there'll be more things coming out when the after-action reports are issued, put together by the department and others associated with it. I'd also like to take a couple of minutes to report on commission activities, if that's appropriate at this time.
Absolutely.
All right. I think just briefly, for folks who wonder what the police commission's up to, we are a commission that's authorized by state law and partially governed by it. In Simsbury, we respond to the Board of Selectmen. And according to the town website, the police commission was created by charter in 1992, and the commission has direct responsibility for citizen matters, budgetary concerns, personnel matters, and collective bargaining matters. The commission serves as the final authority for all personnel and disciplinary matters within the police department. The commission is also charged with the responsibility of investigating all citizen complaints involving the police department. It is a nonpartisan board. It has 2 Democrats, 2 Republicans, and 1 unaffiliated by charter. And so it's nonpartisan. And there are 5 regular members, each having 4 terms. Lately, we have been very consumed with review of the department's activities and the force itself. And I'd like to briefly touch on that because it's going to be coming up very shortly in budget submissions, etc. But we feel, based on national, state, and comparable town statistics and norms, that our police department is currently understaffed by approximately 6 officers. That's incredible, but it's there have been budgetary constraints the last 3 or 4 years that we have not been able to fill vacancies as they've occurred fully, and we also have the situation of a very large increase in town population over those same 3 to 4 years, which beg for more services and beg for more coverage. So just briefly, we have 39 sworn officers now, and we feel very strongly and will be submitting budgetary requests for 45 officers. And where they're going to go, we need two traffic officers. Traffic officers, general handling, traffic enforcement, complaints about road conditions, signs, et cetera. Simsbury has been without any traffic officers since 2017. We need 2, so that's 2 of the 6. Patrol officers just handling all the other duties of the police department, which under Chief Ingerson's authority back when he was hired some 22 years ago now, Simsbury adopted a community policing philosophy. And that is one that is built around not police enforcement, but simply police awareness. And so the citizens, if they have enough awareness of police officers and what we do, they tend to not need enforcement because they believe, they understand, and they participate. So we really need 3 police officers to fulfill those vacancies we've had in the increase in population. The detective staff, we've normally had 3 detectives, but in 2018 dropped down to 2 again because of staffing shortages, and so that's the 6th officer that we need. So that's going to be kind of forthcoming to you all, and we need 1 civilian accreditation specialist because of the fact that we are a nationally accredited police department, very highly professional, very standards oriented, and we want to stay that way. We don't want to slip. We don't want to become something less. But that also, involves work. And so, we're going to have those topics coming forward, and you'll be seeing those soon. And just wanted to give you a little background on that. Thank you.
Commissioner Long, I appreciate that. And it was public safety was a very prominent topic at our Saturday goal setting session for the Board of Selectmen, and I believe will continue at our second. So we received your memo, which has a lot of the information that you just shared with this body there. So I do appreciate that that set of facts and education for the larger group here as we certainly weigh those requests. So I appreciate it, sir.
Thank you.
All right, we could continue. But any other questions for Chief Davis, Commissioner Long? All right, the final bow I'll put on it, Chief Davis, if the officers need anything from the community, as Wendy put out there, please let us know, and we can help facilitate that, because we certainly do always appreciate them, but especially in this current tragic time. So
Thank you. I appreciate it. And the officers definitely appreciate all the support that all the town leaders have shown, and in the community itself as well. So thank you.
thank you, sir. All right, we will move to ambulance. So Karen, do you want to go ahead and take the floor?
Sure. Good morning, everybody.
Good morning.
I have been sifting through numbers. So if you don't have the memo that was attached to the packet that went out, I'll just go over that briefly. It gives you some of our current statistics. So far this year, January through the end of November, there have been 2,266 medical dispatches for the entire town of Simsbury, including calls for mutual aid from Granby and Canton. Of those calls, SVA responded to 1,933 of them, and we transported 1,297 patients. The balance between those two numbers would either be canceled calls or patient refusals, where they did not want to go to the hospital after calling 911. Our mutual aid partners came into town 338 times, and we responded out of town into Granby, Canton, and occasionally Bloomfield 215 times. And what I'm really impressed about is our average response time, or our shoot time, is an impressive 1 minute and 30 seconds, which is the time that it takes from dispatch to the time that we're en route and out the door to going to the scene. To date, our car 17, which is the second ambulance, has been scheduled for over 1,800 hours this year, and we're trying to keep that going. We've been trying to do the 12-hour shift, 7 to 7 Monday, 7 days a week. And we're currently staffing at average anywhere from 50% to 75% of the time. We have increased our staff at least 50%. We currently have 5 full-time paramedics, 3 part-time paramedics. We're up to 6 part-time EMTs and 3 full-time EMTs. And we're still hiring more to keep going with that schedule, to keep it filled out, fleshed out as best we can. So I know, Sean, you wanted to talk about some of the mutual aid numbers and the effect that 17, the program has had on that. Sorry if I'm going too quickly. You can stop me anywhere here and here.
No, go ahead and finish up, and then we'll jump in with questions from there.
Okay, so as anyone can understand, there's obviously no way to predict the number of 911 calls that you will receive at any one time. So the numbers do jump around a bit. But what I found was very interesting is that I'll get my piece of paper here. In August, we had scheduled car 17 for about 274 hours during that month, which led to a decrease of about 11% of mutual aid having to come in, which was pretty good. I'm not sure that's the same chart that you're showing. I've added.
This is a little bit older data, but it should, I mean, it shows.
Doesn't have the car. Yeah, it doesn't have the car 17 hours is what I was talking about. So
no, it doesn't. This shows overall calls of 911 to dispatches, and then you can see the total mutual aids out have obviously dropped. So
well, it did through August, and then things kind of flipped around again. So this is the fluctuation I'm talking about. So we do the best we can to try to stay within. We know 17 is necessary, but it's the effect. Sometimes I have months where we have huge staffing hours and it makes a 1% change, which is just, it's the luck of the draw, not the luck of the draw, but it has to do with the call volume. So we seem to be running, probably at this point, there's been about a consistent 8% change in terms of mutual aid having to come in and about a 2% increase with us going out. But I will say since January, which we're not scheduling 17 at all, we've been able to at least consistently schedule at least 70% of the time. So it's been quite an improvement in terms of time for coverage. And I think it's been felt hopefully by the police department, knowing they don't have to wait for another ambulance to come into town. So, all right, any questions?
yeah, so I think we just pause on that for a second. So I mean, again, I think Karen, you would agree with me that having a second ambulance on, especially during that 7 to 7 shift, does change the mutual aid numbers, right? And I did appreciate the shoot time, but I think folks are particularly interested in the call from 911, the call for 911 to arrival on the scene. Do you offhand know what our average response time is in terms of that 911 call being placed to arrival?
I don't have that at my fingertips, but I will say that one of the things that people have to take into consideration with that is how we're dispatched and the location of the call. So we have a very large area to cover. And if we don't respond to every single call, lights and sirens, oftentimes we go with flow of traffic, and it's based on how the call is dispatched through the EMD process in terms of the medical necessity. So,
understood, but from an overall standpoint, I think folks are not necessarily interested in what time everybody gets in the ambulance. They're interested in what time they get out of the ambulance. So obviously, I get that we have a big town, but I think it's a more important metric to report out to our residents when we are arriving on scene.
Okay, I'm happy to take a look at that. I can give you those numbers for sure, but again, I would have to put some caveats in there about the reason why.
Understood.
Okay, so.
Yep. No, I mean, there are averages to all of this. I get it. The police department and the fire department are under the same lens. There's, if you're in Terriffill and the call's on the south end of town, it takes much longer to get there as a responding officer. We all understand that.
Okay.
So.
But yeah, the program we have that does for our patient care reports definitely calculates those numbers out automatically. So I can certainly provide that easily.
Yeah, I think that would be something that we would love to see as part of these quarterly updates. Just again, not dismissing the shoot time, but again, the residents, what they know is when the lights and sirens show up in front of their house.
Sure. No, I understand.
Yep.
John, if I could just interject a minute.
Please,
one of the things I think also we have to remind our community is that when the call goes out in a 911 call, it's not just the ambulance that is responding. We have a very, very aggressive police response as well. Mm-hmm. And I say that in a positive way when I use the word aggressive. Yes. But the fact of the matter is that, someone at that 911 call or emergency, while it may not be the ambulance first, there is an emergency responder who was there to assess and start to render aid right away. And I think, again, it's another reflection of the, I guess, partnership, if you will, that our community services and emergency services have to make sure that we're getting as quick a response to the citizens as possible, even if we do have to go out of town for mutual aid.
It's an excellent point, Chief, right? Is the ambulance is nothing but a vehicle. It's really the people that respond to the call, right? And there are different levels and different agencies that do respond. So that's a wonderful point. Obviously Chief Davis's officers showing up in oftentimes, I believe, less than 5 minutes to nearly every call in this community is an important thing to reminder. There is a police officer on the scene stabilizing things, providing, as you said, care, providing additional information to ambulance, to other partners to make sure that the appropriate response is seen at the scene. So agreed. everybody does look at the ambulance, but again, it's nothing but a vehicle. It's really who is the person coming and what level of care are they delivering. So it's a great reminder.
Yeah, and Sean, if I could jump in, just perhaps
Yeah.
providing some background in terms of the broader picture. And again, I just really want to thank Karen for all the data analysis that she's done. But what I think has been really helpful, and this is very common, right, and sort of the public safety field, is that we will look at things like peak call volume, right? So you're looking at calls for service, times of the day, days of the week, right? And you're really scheduling your resources around those peak periods of time to ensure that you're staffing appropriately. And I think that it's important to recognize the fact that, Karen and her organization have been doing this. And thank you for showing this slide, because I think, again, that shows an example of that type of analysis that's happening on, an ongoing and regular basis. I think that there maybe have been some questions in the community. Well, why don't you just staff for the sake of staffing? And again, that's just generally not the most effective use of public safety resources. You do, again, want to staff around those peak periods of time. So I really do appreciate the effort that Karen has put into this. And I really want to also thank, Chief Baldus for, referencing the fact that we do have a very robust overall public safety response system. And so as a community, we're very fortunate in that we do have a police officer going and responding to every call for service. When the ambulance comes, we're receiving paramedic level service for every call. Not every community is that fortunate to have that high level of service for every call. And I also think it's important to recognize, as Karen mentioned earlier, that not every call that the ambulance receives is a lights and sirens call. And there's, again, a system in place to help us triage those calls. And for the much more complex calls, there's North Central EMS, which is a dispatch unit that helps, again, with those very, very highly difficult, more significant, transports. And so, again, it's a very complex, system, but I feel very confident that we're very fortunate here and that we're receiving a very high level of service and response from the police department, the fire department, the ambulance company, and just, again, really want to thank all of our partners for working to provide that level of service to us.
I agree. Thank you, Maria, for those comments. And folks can see my screen, Maria. So hopefully it's not an eye chart, but what I would point you to on this is total calls through October. Basically, it's incomplete in terms of up to date, but the point will be made in that this is the 7 o'clock hour down here, and this is the 7 o'clock hour here. So when, obviously, for the professionals on the phone, this, but for the folks following along at home, what that means is 7 to 7 is when Karen, in her professional opinion, is experiencing the highest level of call volume, hence why the second ambulance is being staffed at that point. There are certainly additional times that are popping up beyond that 7 to 7 hour, and I know Karen will continue to look at that. But when we talk about the 7 to 7 schedule for that second ambulance, this is why. Most folks are sleeping during these hours. There's less activity at night. There's less motor vehicle activity. Thankfully, there are less incidents as we all wake up, as we all go to work, get coffee, snow blow the driveway, cut the grass, whatever we do. Sadly, things happen, right? That's as the Chief Davis is shaking his head, right? When we're awake, things happen. When we're sleeping, things don't happen. Again, you could make an argument of 24/7. I'm not dismissing it, but arguably you would have an ambulance that sit there, and in fact, perhaps two ambulances sitting there not responding. Now, certainly we need to make sure that the community is safe. But when we talk about the logic of when do we staff, this is some of the metrics we use as to why. We can certainly talk about a different and higher level of delivery in this community. And I think that's been an ongoing conversation that we have. And I know, Karen, you've been a great partner, as has your board, with having that discussion. But the folks at home need to understand that it comes at a cost. If the ambulance doesn't have a transport, there is no revenue stream to support the staffing and the maintenance and the costs there. We can certainly help Simsbury Ambulance create a model to do it, but it potentially creates a different financial situation. It doesn't mean we're not willing to pay for it, but sadly, nothing in life is free. And when you're going to have folks at this level and this level of professionalism, there are dollars attached to it. So that's part of the ongoing conversation we have as we do this analysis. So I just wanted to provide a little bit of context. And then Karen, to your point, I think this is a graph that really hits home for me. These are the number of times you folks are dispatched. And again, the numbers don't matter. But these are the number of times down here that folks are actually transported. What does that mean? This is, and again, this is a good thing because it means somebody doesn't need to go to the hospital. Presumably they are safe, they are okay. But what it means is that Karen's folks had to arrive on scene, and there is no corresponding revenue stream to account for their salaries, benefits, and cost at that time. Again, very much encouraging folks to always call 911. But this is one of the challenges of running a public safety organization is there isn't always a revenue stream to support that call, which does continue to be something that these folks need to manage. The last piece of data I'll show you all here. Again, folks on this call, forgive me, I know you all know this, but the folks at home, as Karen and team staffed that second ambulance, you'll notice that the mutual aid calls on the dotted line came down, meaning we needed less mutual aid in, and our mutual aid actually went out. So we were actually providing a higher level of support and responsiveness to our neighboring communities. So exactly what we had expected and hoped for, right, Karen?
Exactly.
And I know you're continuing to look at this to see what exactly happened here in September and October. And I know that you're going to continue to make the appropriate staffing and hour changes as needed, to provide the highest level of service. Because I know that that's obviously the first priority for Simsbury Volunteer Ambulance for both you as the leader of that organization and your board. So
I also like to elaborate on the mutual aid part. We're very fortunate in our area because it's not very common in the state of Connecticut for 3 towns to have a mutual aid agreement to cover this entire area. The fact that we have an agreement with Granby and with Canton basically during the day allows us to have, let's see, we have 2 ambulances in Granby, 2 in Simsbury, and 1 in Canton. So basically all of those ambulances are available to cover the Farmington Valley. And there are times where we've gone to Canton and then 2 minutes later, Canton has to come into Simsbury, and it happens all the time. But that network of being able to do that has helped this area so much so because the commercial services are short on staff, they're short on ambulances, they're struggling to make their call volume, but we have this great working arrangement that is a fantastic situation, so much so that we're going to be discussing at the Chiefs meeting tonight because other towns are asking us, how are we doing this? And they would like to know how it's working for us. So Kate Coop and I will be discussing that tonight with the other chiefs. So we're very fortunate.
I appreciate that context, right? Yeah, and I believe Canton's down an ambulance currently, right?
Yes, they are. Yep.
Yeah, that's really important is we're able to help them with that volume. And our staffing increase actually came at a really good time because we would have been down 1 mutual aid transport, which could have been challenging for all of us. So yeah, no, it's really important. It doesn't mean we're resting and we're satisfied. It means that we, we're continuing to review this and make sure that we have the appropriate level of service that this community expects. And that we need to keep folks as safe as we possibly can. So a brief presentation here. I'm happy to field questions at this point. And my peers on the Board of Selectmen will be getting a more robust version of this presentation in January. As Maria said, and Karen said before, Eric and I, along with Maria, some really vested community partners have had some pretty substantial and deep discussions on a lot of these metrics and talking about avenues and ways that we can continue to maintain and improve the level of service that this community expects. So. All right, I drained that issue, but thank you for allowing me the privilege to have that discussion. Further questions for Karen? And Karen, not lost on me that you folks obviously were part of the response this prior weekend, obviously with the primary response and then, holding at an alternative location in case of need. So thank you for being part of assisting with the tragedy this past weekend.
Oh, absolutely. Granby ambulance was also available at the time because they do carry blood on their ambulance. So they were called in as well for help. So fortunately, we didn't need more than the 1 ambulance, but it all went very well. And I'd like to thank the police department for allowing one of their officers to actually drive our ambulance so I could have both of my crew members to be in the back to give care to the patient. So thank you for that.
Yeah, and that's an important point. That was something that I learned, that Granby does carry whole blood now, right? So what does that mean for our community? That means in a traumatic event, there is a supply close by that your paramedics can use, right, during the transport. So
That's correct. And also the AMR Hartford also carries it. So if the direction of travel is away from Granby, we're able to intercept with a paramedic from AMR as well. So.
So I appreciate that. That was something new I learned this weekend as well. So sad circumstances to learn it, but again, another example of partnership and improving the level of service that you all are providing with our neighboring community. So thank you. All right, Chief Baldus, Fire Department.
Yeah, hi, good morning. I'm going to turn this over to Fire Marshal Torville. I'll let him start the presentation today.
All right, good morning, everyone. Quick and easy here. We had some Thanksgiving messaging going out to cooking safety. Seemed to have worked out very well. We only had, I believe, 2 call-outs for cooking mishaps during the Thanksgiving season. So hopefully that messaging was working properly. We currently also have put a freeze on winter safety, shares educational message on heating, holiday decorations, winter storms, and candles, which all contribute to an increased risk of fire during this time of year. Also, some of the feedback we've gotten back from the concerts, we were looking not only just the Darius Rucker concert, also the Simsbury Celebrates, and actually even the Talkit Mountain Music Festival. People walking home after the events, we're finding that they're dark clothed, walking on Route 10, even some of the side roads. So next year, we're going to put an emphasis on trying to put a safety program together on being visible on the streets and try to take care of that problem while it's there. Some of these people are a little bit altered, so to say, when they're walking home and stumble a little bit into the roadways and things like that, which makes it even bigger hazard. However, if we can get them visible, hopefully that will be a help to the community. Also, we have done some updating, working with Tom Hazel from the town on the public gathering permit. We had an opportunity to give input on what we feel should be on that application for the public gathering permit. And that all went well, and that's been updated, and great feedback from all involved with that. Our COVID obviously is impacting us with inspections. We're coming across it in the apartment complexes that we do inspect here in town. We're not entering anybody's residence with a COVID issue for inspection purposes. That's not to be confused with the life safety aspect of everything. We will still go in if we need and take the precautions to do that. However, for our inspection program, we'll be not entering a COVID infected home at that time. We've also, myself and Mike Brown, my deputy fire marshal, have been recertified as open burn officials for the town. And actually, Maria's graciously signed our applications and taken us on for another year. So we've been updated as that. And last but not least, January 18th, we'll be presenting to the Chamber of Commerce members on the Fire Marshal's office and fire inspections. And this is to promote the importance of running a safe and compliant business within our community in conjunction with the Connecticut Fire Code and Fire Prevention Code. And that's that.
Thank you, sir. Appreciate that update.
Thanks, Patrick. From the fire department side, as Patrick mentioned, we did have a nice quiet Thanksgiving holiday, and I think that's kudos to our residents and trying to maintain, safe environments and doing things in a manner that prevents these emergencies from occurring. So we certainly appreciate that, and I will tell you that the volunteers appreciate it as well, because they were able to spend a Thanksgiving dinner at home without any interruptions, so which was kind of nice. As was mentioned earlier, Simsbury Celebrates went extremely well. This was the first time we actually formalized a command post, which was actually housed in the senior center at the Memorial Hall. We did have representatives from the various agencies that were there, which provided instant communication with the different aspects of the Celebrates program and the event starting at 5 o'clock and not finishing up until the fireworks time. Again, it went well, but I think it also, as I think Patrick pointed out, helped to identify some areas for improvements that we can see going on in upcoming years. So I think it certainly was a well worth effort, and certainly thank all those that participated in that. We are right now kind of doing our COVID watch. Very concerned, certainly, with the uptick, putting into place more masking restrictions and so forth, requiring masking in the buildings again, and we'll continue to do so with our groups, drills, and so forth. as the numbers unfortunately go the wrong way. Hopefully we'll see a turnaround and things will loosen up again, but we'll try to maintain that safety element as best we certainly can. We do have a couple of imminent deliveries. One that we've been waiting for a while that was impacted by COVID, and that is the replacement of one of our engines and ladder trucks. We're actually combining the two, which is referred to as a quint. It's an engine ladder combination. That is scheduled, and we are expecting to see that in the first part of the year. It is delayed. We were hopefully to see that last March, but because of COVID and some of the supply chain issues, that has been unfortunately delayed. But we are expecting that finally to get in here the early part of the year. And then sometime later in the spring, we'll see a replacement engine to replace one of our 25-year-old engines that is due for replacement again because of age. So we certainly are anticipating those new replacements and with the training that will go along with it. So other than that, it's been actually fairly quiet, knock on wood. We certainly appreciate the community's efforts in keeping themselves safe. Certainly remember, obviously, we have winter weather coming and driving habits and so forth have to be taken care of. We certainly don't want to have to deal with those type of emergency calls, but certainly thank the community and wish them all a very happy and healthy and safe holiday season.
I agree. Thank you for that, Chief. Yeah, please be careful when you're putting your lights up, taking them down. Measure your oil before you oil or you deep fry your turkey, right, Patrick? So we gotta let's make sure we're staying good on all that stuff.
Gary, Gary, do you have anything you want to add?
Oh, sorry,
Gary Wilcox.
Yeah, the only thing that I would like to add, thank you, Jim, is that with Patrick, and we're glad to see this this date coming up in January, where he's going to have a session with the chamber and address the business community. Patrick's jumped into a situation here where Kevin Kowalski had been our fire marshal for many years, and Patrick has some big shoes to fill, but I think that he's done a very good job, and kudos to Patrick for his effort. And we're working really hard trying to communicate as best we can with all of the town agencies, and it seems to be working. And it's one of the things where communication. So the better we communicate, the better everybody gets along. So thanks, Patrick, for the job you've been doing.
Gary, well said. I agree with that. And Patrick, I do appreciate that your updates are about half as long as your predecessors as well. So thank you. I can't go without a shout at Mr. Kowalski. Do miss him. Mark Massaro, I know you have to leave. So sir, I'll give you the floor real quick from an Eversource standpoint.
Oh, thanks so much. I appreciate it. Not a lot to update. As we're still working through the pandemic, we're working as safely as possible as everyone else. Many of the mandates, we even actually gone above and beyond within our work centers to try to keep our staffs healthy and safe. One of the things I just want to point out, and we've seen an increase in again as we roll into the holiday season, is unfortunately a level of scams where people are trying to get to your residents, our customers, and tricking them into buying gift cards or whatever these special kind of cards are, and their cash is going away. And Eversource is not going to ever ask a customer to go out and do a debit card thing like that. We do offer payment arrangements, and the terms are extremely generous, especially during the times that we're going through. So I would encourage anybody that feels uncomfortable or is unsure of a call or a letter to call our customer service center and verify what's going on. And please do not share your account number, but make the phone call. We have representatives, willing and ready to help. So I would just encourage that, to be mindful, especially during these times heading into the holidays.
Yeah,
and
thank you.
And then one other thing, I think we assisted Public Works with a request on a gate to one of our transmission line right-of-ways. Someone opened it up and was having fun, I guess, out there with ATVs and so forth. So Tom and I have work together to get that addressed and get that closed back up. So no unauthorized access out there. But if those come up, obviously, please let me know.
And I appreciate it, Mark, because it was one of those ones. Was it the Towns Gate? Was it Terrifield Waters Gate? And Eversource stepped up and took care of the problem. So
yeah, and it's town property as well. So there, we want to make sure there's no liability being passed along with the access into town property as well. So,
Mark, I appreciate that partnership. You've done a great job of working with all of us in the community. So thank you for that.
Thank you, and happy holidays, everybody.
You as well. Chris Peterson, we're gonna have to talk about where you were on the night of the 12th up around that gate, but that'll be for another meeting. All right, Board of Education, Neil Sullivan.
Yeah, thank you, Sean. I will keep it brief, similar to Maria's report at the beginning about the uptick in the last month. We have definitely felt that at the school system level with over the last 4 weeks, starting with the Thanksgiving week up until now, our cases have increased every week, both staff and students. And obviously with each of those cases needing to be contact traced, and for students that do have to quarantine to keep them engaged from home, there's a lot that goes into it. So I think everybody will be looking forward to school vacation week, 1 week from today, as will be our last day of school until after the holidays. We have implemented, or the one piece of good news I will say there is that what we're experiencing is pretty mild symptomology for the people who do test positive. But obviously there's been many, many more of them in the last few weeks. So we also have implemented, if you've seen in the news media, the state's screen and stay policy. That's for unvaccinated folks who may have had an exposure, but who were masked the entire time, that they can, through a certain protocol, stay in school. So that does help limit the number of students we need to quarantine, and that's certainly important. But I think out of the entire thing, I would cite two things that have been the biggest strain on the school system. One is staffing at this point. Schools rely on substitute teachers and paraprofessionals and things like that. That's you've probably seen in the papers. That's a very hard market right now to, with substitute teachers, we often relied on our retirees, and older folks are a little less likely to kind of want to come in and take on that work these days. And so that's definitely been a strain on the system. And I think as the pandemic has worn on, all of us are seeing and knowing that we need to pay really close attention to mental health concerns of our students, staff as well, but really our students and their families, because we are seeing more strain on our, sort of social services element of our organization. So hoping to get a reprieve after the holidays from COVID. We felt like with high vaccination rates, you mentioned our 5 to 11 vaccination clinic, that we're pulling all the right levers, but this is a hard time period right now, and hopefully things will turn better after the new year. Happy to take any questions.
Neil, I appreciate that. Just a comment that I think you and the school system have continued to be a leader across the state, and our kids have been in school and have been safe, and you've been at the front edge of making sure they are safe, adapting policies that make sense to keep the kids in school, but also think about everyone else. So I do appreciate that proactiveness because it's made a difference, and having a child that's in the school system certainly benefits from being there with their friends and from your teachers. So thank you for that. And as always, learning never stops. I didn't know that symptomatology was a word. Now I do know that. I Googled it. It is in fact a word. And it is the set of symptoms, characteristics of a medical condition exhibited by a patient. So for those of you that are smarter than me, I'm sorry for the update there, but I learned something new today. So thank you, Neil.
Hey, Sean, I got a quick question for Neil. Hey,
Yeah.
Neil, hi, good morning.
Good morning.
It's Chris. Just thinking about where we are in the year, it's kind of ironic that 2 years ago, January, we start to learn about the COVID comes into the lexicon, right? And then March seemingly be shut down, and you folks have a tough. We all have a tough, but you folks have a tough March, April, May with the scramble to distance learn. So knowing that the UK is facing their spike and we're roughly a couple of weeks behind them as far as the most recent modeling, the last couple of spikes. I know that just, my business partners are in the UK. I speak to them almost every morning, 4:45, 5 o'clock. And right now they're all starting to transition to work from home again, and London is shutting down. So you talk about, we understand that hopefully with Omicron, the vaccination, that one of the most important benefits of the Omicron, the vaccination, is that it lessens the symptoms and the experience that one might have during a positive contraction. But we still have to quarantine. And knowing how tight the labor supply is, worst case scenario, worst case scenario, we have enough of an impact. And I know what that threshold is with your staffing model, but enough of an impact to positives whereby you need to make the determination that in-place schooling is no longer effective. Are we prepared? Do you guys have the contingency plan ready to move back to a full supported virtual learning? Because we can't have a stop start like we did 2 years ago, which you guys did yeoman's, but I'm certainly hopeful you're going to say yes, and that you guys are talking about that now. So I'll stop there and let you comment.
I mean, I certainly think it would take us a couple of days to make that pivot, but having done it now before, it would really be if a staffing crisis came about. Right now, we have not experienced that to the level of, and we are able to, we find. I'll give you an example right now. We have one custodial crew that's pretty heavily hit, but we move custodians from other buildings around, and that's a little bit of what we would do if one building particularly got hit. We could move resources into that place. And, we make strategic decisions with what we do have for substitutes and all of that. A lot more of the high school classes, when there's a teacher out, it simply reverts to there not being a substitute, and the students are given an assignment to work on remotely, and that's how it happens. And you make strategic decisions. So we have talked about it a little bit, Chris. I wouldn't say we've gone into full planning, but I'm quite confident we could make that pivot if we needed to.
All right, so as long as you said that you're quite confident we can, because this group here is all about prevention and preparedness. It's not necessarily talking about the past. And as you know, you've been a part of it. Everybody in this team here does a fantastic job of being prepared. And I just want to make sure that you guys are good. It's good that you guys at least are dialoguing to a certain extent of it. So thank you for saying and giving the confidence that you could make the jump to light speed and successfully.
All right, appreciate that. Thank you, Chris, for the question, Neil for the response. We'll move on to Tom Roy, Public Works.
Well, good morning, everybody. Kind of as we touched on a little bit throughout the meeting, Public Works was proud to be part of the Simsbury Celebrates command post and to use our trucks again as barricades. More so this year, and maybe it was just in light of some of the sad events that preceded Simsbury Celebrates, but the crews out there said that they really felt that they got a lot of support, and people thanked them for being out there. And I know they take a lot of pride in being out there. I promise you, they always make sure the trucks are clean, as well as we put the plows on and fill them with sand. So they are as heavy as they can possibly be to make sure they're an effective deterrent. Later today, we're going to be holding a meeting with some of the members of this committee, where we're going to be meeting with our on-call contractors that handle our disaster preparedness for debris. So in the unfortunate event that if we did have a large either windstorm, snowstorm, ice storm, or tornado, we have pre-positioned contractors that would help us clean up the town just like we did over some of our past storms, and also be in the best position possible to receive the full value of any FEMA funding that may be available.
Right.
So this is a once a year thing that we do just so that everybody on the team is familiar with everybody's capabilities. For our highway department, we've got our first snowfall out of the way for the year. It was a solid 1.5 inches, maybe 2 inches at best, but everything went well. We are facing challenges with staffing right now. In addition to the fact that we are working through COVID and we've had a few folks out, either with confirmed cases or on quarantine, we also have a number of employees that are facing challenges associated with workers' comp and other medical issues. So it's a relatively small staff of the highway department, and when we lose 2 or 3 guys, it can really affect our capabilities. We have procedures in place to allow the staff to work while on quarantine in a safe way, and that was vetted by Farmington Valley Health District last year, and actually became a model for it was used actually throughout New England. We have some plans for replacement fill-ins with other town staff. I know a lot of people will immediately say, well, can we get contractors? And the reality is they're in short supply right now. And if we are not contracting for somebody for every single winter storm, we can't simply ask them to come on a select pick and few basis. They have their other clients that they need to service first. So certainly a concern and something that we're paying a lot of attention to. And with that, I would say hopefully we're going to have a good holiday season. And if anybody has any questions, please let me know.
Tom, just a reiteration that I don't think your folks get enough credit for their role in public safety and what they do for this community, not only in their service delivery, but in the amount of money you folks save us. You know, what could have gotten glossed over in a comment that I know is not lost to those of us on the phone is the fact that you have an on-call disaster relief contractor that's already, FEMA recovery certified. That makes a huge difference in a community like ours. And again, I know nobody on this phone forgets the 2011 storm. We got nearly every penny back as a result of your diligence and your department's diligence in that space as a result of that. And those are the little things that matter that most folks in this community don't understand. And that's why we're able to provide, you folks are able to provide such a high level of service, because you take that proactive, thoughtful approach long before, Chris, to your point of preparedness, so that we get the dollars back, that we're using the tax dollars as wisely as we can. And again, not lost on me, especially during budget time, what you and your department do, Tom, to make sure that you insulate us from future financial loss in this community while providing an extremely high level of service. So thank you for that.
I appreciate it, Sean. Just part of the team.
I know you just do it as part of your day, but not every community enjoys the level of professionalism and service that you provide. So thank you for that.
Thank you.
Maria, Kristen, social services, do we have anything in this space?
Sure. Good morning. Hi, everyone.
Good morning.
We are doing well over at Eno. Staff is healthy so far, thankfully. It's our busy season. We are right now continuing to take applications for the Connecticut Energy Assistance Program. So we encourage anyone that needs assistance with their home heating needs to please get in touch with us so that we can help you with that application. And we are right now in our holiday gift giving program. And on Monday, we will be distributing toys and other items to just about, I think we're at 103 children. So we have been very busy with that. And I want to thank publicly all of our generous donors. My office right now looks a little bit like Necker's. And it's very exciting that we are able to provide such a high level of support to our clients. And I want to also share that we received word that we are going to be the recipients of another grant through the Connecticut Department of Transportation to replace our second oldest dial-a-ride bus. And this comes after receiving the grant last year as well. So with those 2 grants, we will have 2 brand new dial-a-ride vehicles. And we're very excited about that. Like everyone else, we're experiencing difficulties with the supply chain. So our vehicle delivery has been significantly delayed. And we don't have an update on when we're getting it, but we are getting it. And I want to share that we will be sharing some news soon about the relocation of our food pantry. More to come on that. We've been delayed again because of the supply chain, but we're going to be doing a release in January with that very exciting news. So thank you.
Kristen, appreciate all that. And obviously, if there is a need, please don't hesitate to use all of us on this phone to deliver whatever that need is to the community through our communication so that we can get you what you need to help support folks during the winter months.
Thank you. And just one thing that I don't want to forget, as we all said, with the tragic incident and with the strain on folks' mental health over the course of the pandemic, we're seeing more people that are struggling that would normally maybe not struggle. And we do have our youth therapy program open and available where we can help connect any youth in our town with a local therapist. So please don't hesitate to reach out to us. And we also have resources for adults as well. Thank you.
Thank you. That's a great reminder, Kristen. All right. VNA, Nancy, still with us?
Morning. Hopefully
Morning.
you can hear my connection where I am today is not so great. The VNA is fine. We're busy. The biggest news that we have is that we are here many people in the piece about rising
Nancy, I think we're losing you there. You're pretty robotic.
I'm gonna text my feed message.
Beautiful. Go ahead and do that, and I'll go ahead and read it. In the meantime, Sarah, you want to go ahead and give us an update from the business community from Main Street?
Sure. Good morning, everyone. So a couple quick updates. We finished and closed out the equity grant that Main Street was working on with the Farmington Valley Health District, getting some of our communities, some of our businesses, vaccinated. And so that included the restaurants. And then we were able to expand the grant to the local churches as well. So we've closed out that portion. And again, special thanks to the health district for including us on that partnership. I know there's been some talk about Simsbury Celebrates. I actually sit on the newly formed committee. I've sat on it for the past 5 or 6 years, and I definitely want to thank our chairman, Tara Willerep. She does a phenomenal job. It's about 6 or 8 of us that sit on that committee. And I don't think people know this, but the plow trucks have actually been a part of blocking off the exits and entrances for many years. So I think that we've been very proactive in, the safety. We had between 11 and 12,000 people in the downtown this year. So people were really incredibly excited to return back in person for Simsbury Celebrates. And again, we cannot thank the fire district enough. They were an amazing participant, always have been. And our committee has sent a letter out to them as well. We've been hard at work on the cell phone issue, and I think that people have started to see some improvements, but we have more to come. I want to thank this group in particular because we've been really working with the major carriers. They are adding capacity, they are upgrading equipment. There's plans to expand some of the current places where the cell towers are. So we're very hard at work with the town manager's office, and I know that we'll be putting out a short release, I think tomorrow, Maria, to the residents. But we continue to work on this, and we're making a lot of progress and a lot of headway. We will be contacting the businesses because there is one thing where they're saying residents and businesses that have issues inside. So we're going to help do all of the major gaps that we can in the outdoor and the public spaces and what have you, but there's still some buildings that may not get cell phone service. And so there's a free option for a femto cell, which is also called a micro cell, which is good for basically one room. And we'll be putting out some information on how you might be able to request that. Final things, masks. Main Street has handed out over 30,000 masks to our business owners. With the uptick, we're starting to see a request for masks again. And I wanted to remind this group that if any of you would like some KN95 masks, we do still have some, and just added protection a little bit better than the fabric masks. Final thing, We've been working very closely with the police department. Thanks to the police department, again, there were some smash and grabs at the local gyms. And so we set out information not only to the local gyms in our area, but also for them to let their people know, because, you know, they were going in, working out, and then they were coming out to break-ins, you know, in their cars. So they've been doing a great job keeping Main Street and our businesses updated. And our development group, which does include Mr. Torville, and I'll echo Gary Wilcox's comments, you know, has been hard at work. We've been meeting on site with the businesses, and it's very, very effective. So that's it for now.
Sarah, I appreciate that. Thank you. Any questions for Sarah? All right, Nancy was able to provide in the chat the update, and I'll just read it for the folks at home. So we are hearing, and I'm definitely hearing as well, that many folks cannot find testing availability as well as some booster shots. Nancy advises that it's always variable, but we're assisting anyone that is struggling with this and will continue to do so. Due to town funding to help the health district to administer the homebound vaccines, their funding will end by December 21st. And we'll continue to help those moving forward into the new year. Anyone that has questions or needs, especially related to COVID, can reach out to Nancy directly. And obviously, happy holidays from all from Nancy. So Nancy, thank you for that update, and obviously appreciate your partnership. Sorry for the lack of connection this morning. Are there other updates that were missed before I tie a bow on this meeting? Any other questions? So two things. One, thank you to my peers, newly elected First Selectwoman Wendy Maxtutis, who joined us this morning. Wendy, welcome to your new role. Obviously, everybody on this group should probably already knows Wendy from her service to the board already. We have Heather Getz, new member to the Board of Selectmen, Amber Abule, who is our new Deputy First Selectwoman as well. For those of you that haven't yet connected with these two talented folks, please do so. Obviously, they've already hit the ground running. So with Eric and Chris, you've obviously got the full support and attention of the Board of Selectmen here today. So appreciate that, and obviously dominated our priorities and early budgetary discussions, as we alluded to earlier. The final point is I've been humbled to be the chairman of this body for, I believe, 6 years now. And thank you, Wendy, for trusting me to continue to be the chairman for the next 2 years. So for those of you that are disappointed by that, sorry. But I am excited to continue to be here. As a volunteer and a member of this community, having access to you all is phenomenal, but the level of professionalism, support, thoughtfulness, preparedness that you all provide every day, just as part of who you are, is truly amazing. And I'm not just reminded by the tragedies that happened this past weekend, but I think your talents and the level of professionalism that you all bring is on full display when the community is sadly at its worst. You are at your best. So thankful for that. It's truly moving to be a part of such a group of folks that continue no matter what, with COVID, with storms, with the tragedies that have occurred. You all continue to operate at the level with your teams. So thank you for that. Merry Christmas for those that celebrate. Happy holidays to everyone. Happy New Year. And I can't wait to see you all in the new year, and particularly on March 17th for my favorite holiday. So with that, we are adjourned.